Hi, good morning, Callus. My name is Mihiraa. Let's start the warm-up session. Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Which is your favorite destination? Why?
My dream destination is Australia. The first and foremost thing is that Australia has a world-class healthcare system, and I can be a part of it. Secondly, the country has a better standard of living and economic and political stability. Besides, here, nurses are paid well and respected too. In addition, I have many friends and relatives over there, so they can help me during my initial days.
Why did you choose OT?
It is my long-term ambition to work as a registered nurse in any English-speaking country, such as the UK, Ireland, and so on. To meet the requirements to register as a nursing professional there, I need to prove my English language proficiency. Hence, I chose OET to fulfill my dream. Moreover, OET is tailored according to the needs of nursing professionals. Therefore, I believe I could perform well in this test.
What are the current trends in your profession?
Nursing is a dynamic profession, and changes happen daily. Nowadays, technology plays a vital role in my profession. For instance, paper records that we used in the past have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in the present day, a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Are you comfortable working with other doctors and nurses?
I find I work well under a variety of conditions and circumstances, and I take pride in my flexibility. I enjoy working in a team because I often find that different viewpoints can help me find solutions to a problem I might not think of on my own. I also enjoy self-motivating and am equally comfortable working alone.
Your preparation time is over. You can now start your role play.
Hello, I am Miles Carter, one of the community nurses. Am I speaking to Mihiraa?
Yes, I am Mihiraa.
Good morning, Mihiraa. It is wonderful to see you today. The main reason for my visit today is to conduct a routine checkup following your recent hospital discharge after your heart attack. To start our conversation today, could you please tell me how you have been managing at home since you left the hospital?
Hello, Nurse Miles. Thank you for coming. Honestly, it has been really tough. I thought I would start feeling better once I got home, but I just feel so drained all the time. I am taking all my tablets exactly like the doctor told me to, but this constant tiredness is just driving me crazy. I can barely do anything around the house without needing to sit down, and it makes me feel quite anxious about whether I am actually recovering at all.
I truly appreciate you sharing that with me, Mihiraa. It sounds incredibly challenging to deal with that level of exhaustion, but you are doing an excellent job by staying compliant with your medications. I would like us to look a bit closer at what might be causing this fatigue so we can address it properly. Could you describe what this fatigue feels like for you throughout the day?
The fatigue is just there from the moment I wake up, Miles. It impacts everything because even making a cup of tea feels like running a marathon. It seems to get even heavier in the afternoon, and honestly, even when I sit down to rest for an hour, I don't feel refreshed at all.
I'm so sorry to hear that. Mihiraa, we should also consider other potential contributing factors, like sleep, stress, or any new medications.
My sleep has been quite poor because I keep tossing and turning, worrying about my heart. The hospital did start me on a few new tablets, and I remember the doctor mentioning that one of them was a beta blocker to keep my heart rate down.
Thank you for giving me such a clear picture of what you are experiencing, Mihiraa. Knowing that the rest isn't fully restoring your energy and that you are taking a beta blocker helps me understand the situation much better. Before we discuss how to manage this tiredness, I need to check on a few critical safety aspects regarding your heart. Have you been experiencing any other physical symptoms since returning home?
Thankfully, I haven't had any of that scary chest pain like the day I went to the hospital. My breathing is okay when I am just sitting down, though I get a bit breathless if I try to walk too fast. I haven't really noticed any major dizziness, and my legs look normal, not swollen at all. It really is just this massive wave of tiredness that is holding me back.
That is very reassuring to hear that you do not have chest pain, dizziness, or swollen legs, Mihiraa. I want to strongly reassure you about this extreme fatigue because what you are experiencing is actually a very normal part of the recovery process. Your heart muscle is actively healing right now, and your entire body is recovering from the physical trauma of a major medical event. It takes a tremendous amount of energy for your system to repair itself after a heart attack, so feeling completely drained is simply your body's way of forcing you to slow down and rest. On top of that, your system is still adjusting to those vital new medications, like your beta blockers, which naturally lower your heart rate and blood pressure to protect you, but can initially make you feel quite heavy and exhausted. Please remember that your recovery is a gradual process that takes significant time. It is a marathon rather than a sprint. As long as you continue to follow the doctor's instructions, you are on the right track to getting your strength back.
It is a relief to hear that this is normal, Miles. I was genuinely terrified that my heart was failing again because I felt so weak. What can I actually do to handle this day today?
I completely understand that it is hard to sit still, but there are some practical ways we can manage this fatigue together. Mihiraa, I suggest that you break up your daily activities into much smaller, manageable chunks rather than trying to do everything at once. It is vital that you take planned rest periods throughout the day before you reach the point of getting completely exhausted. I also highly recommend that you attend the cardiac rehabilitation sessions, as they provide a safe, supervised environment to help rebuild your stamina. To help us track your progress, I would like you to keep a symptom diary where you note down your daily energy levels and any specific times you feel most tired.
Okay, I can certainly try pacing myself more and resting before I crash. But how do I know if this tiredness is becoming dangerous?
That is a very important question, Mihiraa. I want to stress exactly when you should contact your GP or the cardiac team immediately. You must call them if you notice that your fatigue suddenly worsens significantly, or if any severe warning signs appear, such as the return of chest pain, new shortness of breath, or sudden fainting spells. Mihiraa, your energy levels will gradually return as your heart continues to heal, and please remember that a whole team of support is always available to help you through this journey.
That makes perfect sense.
Mihiraa, to summarize our whole discussion today for your absolute clarity, we confirmed that your recovery is on track and that your severe fatigue is a normal response to your heart healing and adjusting to your new beta blockers. You confirmed you have no dangerous symptoms like chest pain or swelling. Moving forward, you are going to pace your activities, rest proactively, attend cardiac rehab, and maintain a daily symptom diary, while keeping a close eye out for any worsening symptoms that would require you to call your GP. Does this summary sound clear to you?
Yes, Miles, you have summarized everything beautifully. Thank you so much for your guidance today.
You are very welcome, Mihiraa.